Okay, this is getting us to the first of our lower extremity videos, and probably the best place to start is the pelvis. It's sort of like an engineering marvel for some of the things that we have in the pelvis, and so let's go over that to begin. It's a great place to start. Okay, first of all, the pelvic girdle, okay, um, goes by a bunch of names. Sometimes people call them the hip bones or the coxal bones or the os coxae, or also known as the innominate bones. So if you hear any of those things, hip bones, coxal bones, os coxae, or innominate bones, we're talking about basically about the pelvis. What the pelvis is in an adult, it's basically two bones which are joined in three places. Okay, it's joined anteriorly, okay, which is right here at this point right here, which is called the pubic symphysis. A little disc, a cartilage disc that sits right in that area that joins the pelvis together anteriorly. And posteriorly, it unites at the sacroiliac joint. This is the sacroiliac joint back in here, and the sacroiliac joint right back in there. Okay, whoops, that one left. Okay, those are the sacroiliac joints right there. Okay, so there's 3 points. 1, 2, 3, where this pelvis comes together. And what it does, it actually forms a ring. Okay, forms a ring by the two hip bones or the two coxal bones, and this is called the bony pelvis. Okay, a couple things about the pelvis. When we talked about the function of bone, the pelvis actually is interesting because what it is, it's a really strong and stable support for the vertebral column. It's bearing a lot of body weight, and a large part of our body mass is from the hips on up. Okay, and you got to remember this pelvis is supporting a good amount of weight, so it's very strong and stable support for the vertebral column in the upper portion of the body. It's the articulation for the area of the hips, and this will be the hip joint right here, and here's a hip joint right there. We'll talk a little about that in a minute. But what it also does, it protects the pelvic organs. Okay, we'll talk about what's the true pelvis and the false pelvis in a little bit towards the end of this discussion. But it does protect some of the pelvic organs, particularly the ones that sit down deep inside this, which is called the true pelvis, deep down inside, such as the bladder, and in females the uterus and fallopian tubes and stuff like that. So we'll talk about those a little bit later as we go on with this discussion. Okay, I love this picture. This is really sort of neat. This is what's called a 3D CT. Okay, it's a CT scan, but they take it and they're able to computer generate it together, into a nice image. Okay, and as a result, what we see here is here's the pelvis right here. We can see the pelvis right here. Here's that area of the pubic symphysis. Let me use a different color here. Here's the pubic symphysis. Here's the SI joint here. Here's the SI joint right there. And so you can see the pelvis in all its pomp and glory. Okay, so this area up here would be called the ilium. Okay, down here this is called the ischium. That's the ilium, and this is going to be the pubis, and we'll talk about all those during the time. But I like this picture. This is really sort of a very cool picture. Okay, I'll get some more 3D CTs for you, which is nice. Obviously, we'll talk a little bit later in an upcoming discussion about this area. This will be the femur and stuff like that. So we'll talk about that later on. So what is the pelvis? First of all, it's really in the adults. It's a combination of three bones, like I mentioned. It's a combination of three separate bones. First is the ilium, and the ilium is the superior portion. So if I'm going to do the ilium, I'm going to color in the ilium. This will be the ilium up in here. Okay, same thing on this side. So the ilium would be this area in here. Okay, that's the ilium. That's the superior portion. It's the part you feel. If you feel your hips, above, you'll feel that little wing in the lower portion, just above the hip joint. You'll feel this like crest, and that's called the iliac crest, which is this area right in here, this area right in here. Below that, below the ilium, we have the ischium. Okay, and the ischium is this part down in here. Okay, and this part down here is going to be the ischium. It comes up the back, and we'll see it when we look at a different view. So this is the ischium. It comes here. Okay, it's posterior and inferior. When you're at a game and you're sitting on one of those crazy hard benches and you have to keep on squirming your butt around and stuff like that, that's because this is bearing a lot of weight right down here in that ischium. The ischium right here at the bottom also is where the hamstrings, or the muscles that attach, are there in the back of the thigh, actually attached to right there. The fourth bone we have is the pubis, and the pubis is this area out in here, this bar out in front, and that's the pubis. It's anterior and inferior to the ilium. Okay, in the newborn, this is actually in three separate bones, and they're connected by cartilage. We talked about how bones will form, and let me show you an idea about that. Now, this is just looking. Let me get rid of my drawing here so you can see. Get rid of that. Okay, that's just looking at the pelvis. We got some better pictures of that. But let's look at this. This is basically going through various stages. So if we look up in here, this is a newborn. Okay, is a newborn up in here. You can see a little bit of the ilium there, and you can see a little bit of the ischium down there, and maybe a little bit of the pubis. Not much, you know. You don't see a whole lot of the bones. And this is a little bit later. This is as a child, and we're starting to see more ilium and more pubis and ischium down here. Starting to see more ilium, but you see it's still separated. This is a little bit an older child, okay? So here's the iliac crest pretty well formed. The ischium's all there, the pubis is all there, okay? And then you can see it's still inside this the hip joint, which is called, or the hip socket, which is called the acetabulum. You can still see it's open. You know, see how it's a little open right at that point. You also tell that this is a growing child. Why? There's a growth plate there. There's a growth plate right there. See a growth plate there. See a growth plate there. Okay, so this child's still growing. This is the femoral. This one right here is really a bear, and we'll talk about that later on when we talk a little bit more about the femur. That one sometimes causes some significant problems. But you can see that development of the pelvis as it goes from a newborn to an infant, you know, to a child. Okay, down in here. That's an actually pretty older child. So anyway, so we can see that development of the pelvis. This is just looking at the pelvis, a little model of the pelvis, and again, pretty much what we've seen before. Here's the area where that pubic symphysis would be, and this area right here would be filled in with that cartilage. It's a fibrocartilage disc that sits right in here that holds the pelvis together in the front. Okay, sometimes it's interesting because even though the pelvis is pretty stable, it's not unusual where that disc. Sometimes we actually have part of the pelvis that may slide and go up or down on one side or the other. And they get what's called an offset pubis, which is actually sort of interesting. Here's the sacroiliac joint here, sacroiliac joint right here. Here's the iliac crest in here. This is the ischium. This is the pubis, ischium. Okay, this area right here would be the acetabular region, Okay. And again, if I'm looking at the bone from both the lateral side, so here's looking from the lateral, so this is lateral, okay? That's from the outside looking in, and this is from the inside looking out, so that's medial looking inside out, okay? So we could look at there, and you can see how we sort of divide the pelvis into those three bones. The green would be the ilium, okay? The green's the ilium area. We talked about the orange here is the ischium, okay? Orange is going to be the ischium, okay? And the sort of purple, okay, is called the pubis. And this is sort of interesting, and we'll talk a little bit more about this later on. Here is the hip socket. This right here is called the acetabulum, okay? And you can see how all three bones, the ilium, the ischium, and the pubis, they all come together in like this diagonal triangular Y-shaped relationship inside the socket, inside that acetabulum, okay? And that hip socket's called the acetabulum. We'll talk about that a little bit later, okay? This is, you can actually, if we start to go back and look at some parts of the pelvis here, there are a number of parts here, and this is actually a very nice image to stop and look at because it shows pretty much everything we really want to talk about. You know, if we look at, here's the iliac crest, which is going to be up at the top. This area right here is called the anterior superior iliac spine. If you feel that iliac crest and you come to the very front of the pelvis, you'll feel a little bump. Okay, and that's called the anterior superior iliac spine. Most people, instead of just saying anterior superior iliac spine, they say ASIS. Anterior superior iliac spine. Okay, so that's an area that it's an important anatomical landmark. I used to do a lot of times if I was looking for somebody with a limb length problem, I'd look at the ASIS a lot in regards to that was an important physical point for me to look at to be able to judge the level of the length of their legs. Okay, here's the anterior inferior iliac spine, which you can't really feel as much, but all you got to remember, if you have a bump on a bone, it means something attaches to that. Okay, this right here is called the acetabulum, which is that hip socket that we talked about a few minutes ago. This right here, you'll see, we're going to talk about it a little bit more. It's called the arcuate line. It's basically a line that comes down through the pelvis, okay? Sort of a crest or a ridge, which everything above it is going to be what's called the false pelvis. Things below it are going to be called the true pelvis, okay? This is called the superior ramus of the pubis right here. A ramus means bar, So you can see this is sort of like a bar-shaped area, so that's called the superior ramus of the pubis, okay? At the top right in here, there's a little bump, and it's called the pubic tubercle, okay? It's basically for an attachment. There's a ligament that actually goes from the ASIS across this way, which is called the inguinal ligament. It comes across like that, and that's that crease. If you feel that crease in the top of the leg, and it feels sort of hard in there, That's this ligament that goes from across from one place to the other, and that's called the inguinal ligament. Okay, this is the body of the pubis. That's right here. The body is the main portion. Okay, this would be the articular surface of the pubis. Right here is where the cartilage would attach. To attach one half of the pelvis to the other half of the pelvis. Here's the inferior ramus of the pubis. Again, ramus means bar. Okay, ramus means bar. Okay. So that's my inferior pubic ramus right there. This is my ischiopubic ramus down in here because it's that bar that joins the pubis here with the ischium. Okay, so that's that. This is the ischioramus down in here. This is the ischium, this whole area right here. We talked about this before. This is called the obturator foramen. We talked about it when we talked about processes and depressions. And that's an open area that's right here. We can see the obturator foramen right here. And basically that's not really totally open. It's covered with a membrane. And things will actually pierce through it. And it also provides for an area for attachment of various muscles. There's a little notch down here which is called the lesser sciatic notch. We can also see that lesser sciatic notch right here. Okay, so the lesser sciatic notch you see right here, and we've talked about these things. So, okay, we've talked about all that over here. Lesser sciatic notch, ischial spine, and it's a little bump that's on the back of the pubis. We'll talk about that. We'll see that a little bit later. This is called the greater sciatic notch. So this is the greater sciatic notch. It's a larger notch. Lesser, so the lesser is here. Greater is here. Okay, so that's the greater sciatic notch. Sciatic nerve we'll talk a little bit more about later on in the semester. And this is the posterior superior iliac spine, or posterior inferior iliac spine, posterior superior iliac spine. Okay, sometimes they call that PSIS and PIIS. Okay, so anyway, that's pretty much what we've seen. We'll talk more about these. We'll break this down a little bit more. But this just shows a good breakdown of all the different landmarks that we're going to be talking about. There's a couple more that we're going to be adding, iliopectineal line and stuff like that, so we'll talk about those. Let's talk first about the ilium. And the ilium is the largest of the coxal bones, okay? The biggest part out here, this part right here, okay, is that wing. It's called the ala. Ala. Ala means wing. If you look at your nose, when you look at the nostrils, it flares out on the side. That's the alar portion of the nose. So it's sort of like a little wing on both sides. That looks bad, doesn't it? On both sides of the nostril. Okay, and so ala means wing. So this area up in here is called the alar portion. The rest in here is called the body. So the body is this portion in here. The body of that would be there, and it's basically the superior portion of the acetabulum. And again, that acetabulum is the hip joint, okay, and that socket for the hip, for the femoral head, which is round, to sit inside that socket. So it's actually the superior portion. We talked about how the acetabulum is divided by a Y, okay. So this up in here would be the ilium. The top portion would be the ilium, okay. Let's talk a little bit about going over those landmarks again. This area right here is called the iliac crest. That's that part that you can feel. When you feel the sides, you can feel that large crest-shaped area of bone, and that's the iliac crest, okay? So that's important. And then again, if we look at the anterior portion, here's my anterior superior iliac spine, you know, sitting out there. And here's my anterior inferior iliac spine. Anterior superior would be right here. Anterior inferior is going to be sitting right here. Superior right here, inferior sitting right there. Here's my posterior superior iliac spine would be up in here, okay, and my posterior inferior would be right there, okay. And again, these are basically, because they're bumps, if you have a bump like we talked about in the processes, a bump means that something's going to attach there, whether it be that inguinal ligament, whether it be a muscle. Part of the quadriceps muscles will attach right here at the anterior inferior iliac spine, particularly the long one that goes right down the front of the quadriceps. We have the greater sciatic notch, okay, and that greater sciatic notch is this large notch right there, the greater sciatic notch, which is just inferior to the posterior inferior iliac spine, okay? And that's the notch for the sciatic nerve. Now, let me just mention something about the sciatic nerve while we're at it. Sciatic nerve is actually a large nerve. If you ever get a chance to do a cadaver dissection or anything like that, the sciatic nerve is actually relatively large. It's about a ½ inch wide. It's a big flat band of a nerve, about a ½ inch wide. It comes through that area of that greater sciatic notch, and it's actually a combination of a number of nerve roots that come from the spinal cord. Okay, and that sciatic nerve then goes down the back of the leg, and it goes down the back of the leg. It gives us off various branches along as it goes down the back of the leg. That's why people, when they have like that sciatica, okay, what they'll say, oh, my sciatic's bothering me. They really complain of shooting pain that goes down the back of the thigh. And that's and weakness and stuff like that, and numbness and various unusual sensations, all the way down to the leg and the foot. Because what happens is even though it's in the back, it's going to supply a lot of the muscles and a lot of the skin that will supply the whole leg. Okay, but that large trunk goes right down the whole back. It looks almost like a tendon. You know, if you look at someone who's never dissected a cadaver, they get down, they find the sciatic nerve, they say, well, this is a big tendon. It's really not. It's a sciatic nerve. Okay, but it fits that greater sciatic notch. Okay, iliac fossa. Okay, and here's the iliac fossa. This area in here. What happens is the pelvis comes and forms like those two ala form like a wing, and it's a cup. Okay, and this area up above is going to be called the false pelvis. The false pelvis will be up in here. Okay, and that's by part of this is by that big cup of that iliac fossa. Okay, so that's what we see with the iliac fossa. Okay, so we can see that at that point. Okay. Don't worry about the tuberosity so much. That's not really a big thing. Auricular surface. I think that if you, this is the well, what the heck, yeah. Let me just talk a little about this auricular surface and the iliac tuberosity while we're at it, okay? And put it all together, the iliac tuberosity and the auricular surface. If you actually look at this area in here on the back, it's bumpy and lumpy because it's going to be attachment. There are a number of ligaments, sacroiliac ligaments, that hold the ilium to the sacrum. The sacrum is part of the vertebral column, okay? And right next to the area of the iliac tuberosity in the back is this area that's right here, which sits in front, which is called the auricular surface. Now, if you look at the auricular surface, if you look at it, it's lumpy, bumpy. It's very lumpy, bumpy, very irregular, very jagged, okay? Not really sharp. It looks like sort of like the inside of an English muffin, I guess, okay? And this is because what happens is we want that sacroiliac joint, which is relatively flat, you know, to have good adhesion. So what the inside of that auricular surface is lumpy bumpy, so that what happens where the sacrum reaches it is also lumpy bumpy, and the peaks on one side fit in a depression on the other, and then just vice versa. So as a result, it becomes actually relatively stable. Okay, we do have some times when that sacroiliac joint does become inflamed, with there's a little bit of rotational motion of the pelvis, and that's when people complain a lot of low back pain and stuff like that. It might be SI joint, which is basically here. If you actually take the hip and you have someone lie on their back and you have them cross their leg and you force down on their knee and you twist it, pushes that, and that sometimes causes pain there. I'd have to show you to actually, so forget that. We'll take that back, okay? Anyway, so that's what we see so far there with the iliac fossa, the iliac tuberosity, and the auricular surface, okay? The last thing I want to mention here on this individual image is the arcuate line, and this is the arcuate line right here, and it's basically a ridge, okay? It's more than just a line. Sometimes a line is a very small elevation, but this is actually a dividing line that divides which would be the false pelvis above from the true pelvis below that area of the arcuate line. It runs from a superior posterior to anterior inferior. Now this shows you a better picture. So here's the arcuate line right here, and here's that area right there. That's the arcuate line. Okay, it's going to continue on, called the pectineal line or the iliopectineal line when we get to the pubis. But this area of that line, which is actually very, very prominent in humans, I'll show you on some other specimens. It's called the arcuate line. So everything above here would be the false pelvis. Everything down here would be the true pelvis below that arcuate line. It's the bottom portion of that cup from the iliac, from the alar region of the ilium. So we do see also on this, we see the iliac crest, Here's the anterior superior iliac spine, anterior inferior iliac spine. Here's that iliac tuberosity, okay? And this would be the alar surface. If you look really close, you see how it sort of, I mean, these lumps and bumps aren't really big, but they're very small, but they're confluent with the lumps and bumps on the opposite side in the sacrum that will fill this area up. So that's the auricular surface of the ilium, okay? And let me get rid of that so you can actually take another quick look at that, or you can stop the video at this point and you can see all that stuff. So anyway, that's part of the ilium, okay? The lateral ilium, okay? This is where it's sort of difficult to see some things, okay? What happens in the lateral ilium, they have what are called the gluteal lines, okay? And some, even in the lab, when you bring out a pelvis and you start to look at the pelvis, sometimes you can't see these as well as you should, okay? You know, there are a number of what I call these gluteal lines. Here's a posterior gluteal line. Here's a anterior gluteal line. And, you know, they're very, very difficult to actually see, okay? And what happens is these lines, these gluteal lines, basically are lines that are, and they're very faint. They're very, very small. They're not like the arcuate line. The arcuate line is very prominent, but these gluteal lines aren't really easily seen. There's another inferior line which comes down here, and what they are is they're sort of like guidelines, or they're like if you look at a map. You know, like a map of the United States, they'll have all the states divided by a little line. And that's what this basically is. It says certain muscles will attach below the line, certain muscles will attach above the line. Because you got to remember, this is on the outside, the lateral side of that iliac, the alar surface of the ilium. It's on the outside. So the gluteal muscles are filling this whole area right there. And we have a gluteus maximus, a gluteus medius, and a gluteus minimus. And basically these lines are going to sort of like define the border where one muscle is as compared to another. Okay. Again, they're really difficult to see in most iliums. They're hard to see. You have to sort of imagine them a little bit more than anything else. But they're called gluteal lines. And again, you can see those here. Here's, you can actually see a little bit of the anterior gluteal line right there. If you look, I can't really see much of a posterior gluteal line on here at all. But what I've done is I've actually put things together. Here's the iliac crest, you know, so you can see it on one. I've connected them with little red arrows. You can see here's the anterior superior iliac spine. This would be the anterior inferior iliac spine, which should be in here. So I should have actually, let me do this. There we go. Okay, now we're good. Now we've got it all together. Okay, so that's that. We can see the greater sciatic notch from one side to the other. Here's the acetabulum. Okay, this is the ischial spine right in this area. Ischial tuberosity right there. So you can actually go back and forth and look at those things. Posterior superior iliac spine would be in this area. Posterior inferior iliac spine would be right there. Here's the lesser sciatic notch right there, greater sciatic notch. You know, so these things you can compare from a diagram to what's a true pelvis, okay? Looking laterally. The ischium, okay? The ischium is the inferior posterior portion. So if I'm looking, you know, at this is the ischium down in here. This part of the horseshoe, okay, is the ischium, okay? So this is looking from the inside on this side. This is from the inside. This is looking from the outside, okay, on this side. So this is looking inside. That's in. That's out over here, okay? And what happens? It comes up. This is the body of the ischium, okay? And the body of the ischium is going to be this area right in here, okay? That's the body of the ischium. Can draw it in here. It's going to be inside in this area, okay? We have the inferior ramus, okay? And the inferior ramus is going to be right here, which joins with the pubis. The pubis is going to be this bone right here, okay? And then the ischium is this bone all in here, okay? So ischial spine, you know, basically there's going to be a little spine that's going to be in there. Here's the ischial spine. That's right. That separates the greater and the lesser sciatic notch. Here's my lesser sciatic notch. So there's the ischial spine right there. There's the lesser sciatic notch right there. Here's the greater sciatic notch. Okay, this right here is the ischial tuberosity down at the bottom, and you can actually see it better here. Here's the ischial tuberosity right there. Okay, you can see it a little bit better. It's very rough. Okay, if you look at it, it has lots of lumps and bumps on it. I mean, not big lumps and bumps, but small little lumps and bumps. And basically, the hamstrings hamstring muscles will attach to this ischial tuberosity. Again, like I mentioned before, when you're sitting on a real hard bench or a hard chair, you have to keep on squirming your butt around because it gets a little uncomfortable. You're actually sitting on this portion on the ischial tuberosity. Okay, has a secondary center of ossification that's down there as well, which is actually long. Okay, I remember I had a patient a number of years ago who was having all kinds of hip pain, and they had looked and looked and looked and looked and looked to try to figure out what in the world was wrong with her. She had all kinds of problems. She had an eating disorder, and she had all kinds of problems. And she had multiple stress fractures and stuff like that. So I sent her to me to look, and basically she had a couple growth plates, and she was in her 20s. She had a couple growth plates that were still open, one along the iliac crest and one here in the area of the ischium. Okay, and her development had been delayed because she was a very high mileage runner. She was running tons. She was running, sometimes 100 miles a week. I mean, this girl would go on these long runs every Saturday and Sunday. They would knock your socks off. But she was also had an eating disorder. She had body fat that was like less than 3%. She was amenorrheic because estrogen is involved with body fat, and all kinds of problems. Finally, the nutritionist got her back into eating correctly, and basically these things eventually went unfused. Also, I saw a lady who had some pain that was deep in the buttock region, and the doctor another guy had looked at her and said, I can't see anything right there, just a muscle strain. But when I looked at her, she had avulsed. Avulsion means she pulls off a piece of bone. Where a tendon attaches to bone, sometimes the pull of the tendon will pull off a little chunk of that bone with it, and that's called an avulsion fracture. And she had an avulsion fracture of the hamstrings, or at least part of the hamstrings, right here at the area of the ischial tuberosity. So that's the ischial tuberosity. It's the posterior portion of the acetabulum. So again, if we divide the acetabulum like there, that's the ischial portion. It sits right in there in the acetabulum, and it's also the posterior portion of that obturator foramen. Okay, so here's the obturator foramen right here. So if we divide it like right here, this part would be pubis right here, and this is ischium down here. So basically, this part of the obturator foramen really is sort of like that, like the borderline across Lake Erie between Canada and Ohio. So it's right there. Okay. Now the pubis is the last portion of the pelvis, and that's anterior and inferior. So if I'm looking at the pubis in this area right here, I'm looking at this area right here, and a little bit down this way. Okay. It's going to be the anterior portion of the acetabulum, like we talked about. This is the superior ramus. Superior ramus. Okay. Ramus again means what? Means bar. Here's the superior ramus right there, and that's where the pubis connects to the ilium. Okay, so that's where it connects to the ilium. The inferior ramus, which is this area right here, connects to the ischium. Okay, and then the body is this portion right there. Okay, between the rami. The front here is called the pubic crest, along the top ridge right there. Okay, it's called the pubic crest. We talked about that acetabulum again, divided by y. The ilium would be up in here, the ischium would be posterior, and the pubis is here. Okay, so the anterior portion of the acetabulum belongs to the pubis. It's their territory. It's on the top of the pubis. Okay, and you really can't see it on this diagram, but on the top of the pubis, right in about an area right about here will be something called the pubic tubercle. Okay, and basically that's the beginning of the iliopectineal line. And what happens is that arcuate line comes down this way and it continues on along the pubis, which is called the iliopectineal line. So the posterior portion would be called the arcuate line, and then here would be called the iliopectineal line or the pectineal line. Okay, pectineal line or iliopectineal line is fine with me. Okay, but that's what we see in the pubis. Okay, that pubic symphysis, like I mentioned, is a fibrocartilaginous disc. It's a small little disc that holds the two together, and it creates what happens is the pubic symphysis from one side. Okay, and here's the obturator foramen. Here's the superior pubic ramus going to the ilium. Here's the inferior pubic ramus going to the ischium. Okay, it meets the other side coming this way. Okay, and that fibrocartilaginous disc is sitting right in this area right here, okay? And that's just basically the pubic, it's called the pubic symphysis, okay? Symphysis is a type of joint. We'll talk about that. They'll be coming up when we talk about articulations. It's in another video. If you want to look at the articulations video, you'll see one little thing it talks about is symphysis. That's what we're talking about there. Interesting enough, okay, and we won't talk a lot about pregnancy, but what happens is during pregnancy, you got to remember that the biggest limitation to childbirth is what? The size of the baby matching the size of that pelvic rim, okay, or pelvic brim they call it because it's the beginning. I have to get the baby's head down through that. Well, a couple things happen. During pregnancy, there's also a number of other hormones that are produced, and one is called relaxin. And relaxin is a hormone that actually lets soft tissue stretch a little bit. Okay, it makes them a little bit more flexible and allows the pubic symphysis to actually stretch out a little bit, as well as in the SI joint. Lets the SI joint become a little bit more relaxed as well, which there opens the pelvic size to allow the head to come down through the area of the pelvic brim and through the birth canal. Okay, also it causes the changes in gait. If you ever watch a pregnant lady walk, okay. Please don't do it, obviously, because then they'll be calling, like if we're back, they'll be calling the mall police to see. But anyway, you know, they have a little bit changed. They have a widened gait, probably because of the weight and the center of gravity being changed by a pregnant uterus and things getting bigger. But what happens, there is a little bit of more of a side-to-side walk, and that's probably because of that relaxation of that pubic symphysis, because that hormone called relaxin. Okay, so there will be so if you know someone that's pregnant and they don't mind you sitting there staring at them while they're walking, you can actually see a few other changes. And again, a lot of it has to do with the weight of the fetus as well as the uterus, and the change in the location of the center of gravity in the body, and that actually sort of precipitates or produces that change in gait. Okay, so that's what we see with that. Again, this is that pubic symphysis that's sort of circled by the bar. This is a male pelvis. Okay, I could tell, and you'll be able to tell a little bit later why this is a male pelvis. Here's that pubic tubercle would be in here. Pubic tubercle. Here would be the area of the iliopectineal line, and back here would be the arcuate line. Arcuate line. Let me do that in a different color. Arcuate line is going to be back in here. And here would be the iliopectineal line. Here's the acetabulum we see right there. That's the pubic symphysis. Here's the superior pubic ramus, inferior pubic ramus. This is the ischium right there. Okay, so that's pretty much identifying where we're at. This would be the body of the pubis, and here the body of the pubis in here. Okay, so hopefully that makes all sense to you. Let me get rid of that, so if you wanted to stop and go back and look at it, you could see where all those things are. Okay. Okay, ready? Stop. Okay, now I can look again. Okay. Acetabulum. Okay, and that acetabulum is an important word, and this comes up a lot. Acetabulum is the hip joint socket. I wish I was at school because I actually have some artificial hips, or some hip implants, which basically has a socket that goes for that. They ream this area out, in an adult if they have a hip replacement, and they put in an artificial socket inside there, and that attaches, and then the head, they take off the distal or the proximal end of the femur, has a big long shaft down this prosthesis, stick it down the shaft, stick it back in, big ball that goes inside the socket. But what happens is the acetabulum is a deep fossa or deep socket. It's again by all three bones. If we look at this in here, we see how it's divided into thirds. That upper third right here is part of the ilium. Okay, the anterior third is going to be from the pubis, and the posterior third is basically from the ischium. Okay, so that's that socket for the femoral head. The femoral head is going to be a round ball that's going to fit in that acetabulum, which is that socket. Okay, so the acetabulum and plus the femoral head would be called the coxal joint. Okay, a couple things that are in there that we could look at. You don't see it really well on this. Let me get rid of my little drawings here. Okay, is there's a little notch on the bottom. And actually, you can see where if you look at the outside of this, you can actually see a rim here, and it's supported by a cartilage rim on the outside. There's a notch on the bottom. Okay, it's called the acetabular notch. Okay, it's the inferior portion. It's the bottom portion. It's a little indentation. I have to be able to get some blood vessels inside there, as well as there's some ligaments that actually will go across this area that connects the bottom portion. Basically, it's a cartilage rim that sits in there, inside there. Okay. We talked about the false versus the true pelvis a little bit before, okay? And what happens is if we look at this is looking at the from the inside, because the acetabulum would be looking from the outside in. If I don't see the acetabulum, I'm looking from the inside out, okay? And basically, when we look at this, what divides the what's called the true pelvis from the false pelvis. And this is actually very, very simple. Okay, we talked about this a little bit before. If I look at the ilium, I have that line that goes from the sacrum, because the sacrum is going to be attaching right in here. I have that line that goes right here, which is called the arcuate line. Okay, so we go along the arcuate line, okay, as we go towards the area of the pubis, and then from the pubis, I go along that pectineal line or iliopectineal line that goes forward this way. Everything above is called the false pelvis. Everything below is called the true. False up on the top, true below, okay? So that's that line that divides the false pelvis from the true pelvis. What sits in the true pelvis? Again, like things like the bladder, the uterus, and pelvic organs. What sits in the false pelvis? Intestines and everything else. All the other abdominal organs sit inside that false pelvis. But basically, again, when I look at what divides it, you start at the arcuate line goes forward, the arcuate line actually continues on in the iliopectineal line all the way to that area of the pubic tubercle on one side, and from one pubic tubercle to the other, and then we follow it around all the way towards the sacrum. In the back also, the sacrum has a little bit of a bump like this. If I'm looking at the sacrum from the side, it has a little bump. So this area right here would be that little bump area, and that's called the sacral promontory. Which is a ridge, and so that the dividing line would be from the sacral promontory, which would be here, that high portion. It'd be coming out of the screen here, following along the arcuate line to the iliopectineal line, from one pubic tubercle to the other, along the other iliopectineal line, arcuate line, and then back across that sacral promontory. I'll show you another picture from a different viewpoint, okay? And that divides the false pelvis above from the true pelvis below, okay? This would be the area that sacral promontory would be right there, okay? So here's the arcuate line that comes across. So the sacral promontory, actually sacral promontory goes this whole area right here, okay? Because again, here's the SI joint would be in this area, SI joint would be in this area. So we'd start at that sacral promontory. Let me do it with it a little bit bigger, okay? Sacral promontory is going to be right here, okay? Continue on with the arcuate line, and then finish that off with the iliopectineal line, across the pubic tubercles, across the pubic symphysis, and that divides the false pelvis above from the true pelvis below. Okay, again, and so if we talk about the false pelvis, it's above this line. It's superior. This area right here, okay, it's called the pelvic brim. You can see it up there at the top. Okay, pelvic brim, and that's that ring that's formed by the sacral promontory, the arcuate line, the iliopectineal line, arcuate line, and sacral promontory. Okay, so that true pelvis behind here, these would be the lumbar vertebrae. Back in here, the lumbar vertebrae, the ala region of the ilium on both sides. Okay, and the anterior abdominal wall would be here. So from here over to here would be anterior abdominal wall. It's really more the abdominal organs that are fitting in there, the large intestine, the small intestine, and stuff like that are going to be sitting in there. It doesn't really contain any of the pelvic organs, except in certain situations where we might have a full bladder, okay? And when the bladder fills, we talked about cells being those transitional cells that are able to stretch, okay, detrusor. And what happens is, as the bladder gets full, normally it sits behind this area, right behind the pubic symphysis. But as it gets full, it starts to come up above that level of that pubic symphysis. It gets higher and higher and higher, okay? Also, a pregnant uterus is now out of that true pelvis and sitting in the false pelvis. And actually, the uterus with the fetus will go all the way up to the area of the xiphoid, which is that little inferior portion of the sternum, okay? It'll go very high. The true pelvis is everything below that line, okay? Again, here's my sacral promontory. Here's my arcuate line. Here's my iliopectineal line. Everything below it, down in here, below that, is called the true pelvis. So what do we have down in there, in that true pelvis? Actually, you're going to have the sacrum, back in here. Okay, so if we look back in this area, the sacrum and the coccyx are going to be sitting back in there. We have here's the ischium is going to be sitting down in there. Some little spines are going to be pointing down that way. The pubis would be anterior, so behind the area of the pubic symphysis would still be part of the true pelvis, because the top rim of the pubis above that's going to be the false pelvis. Okay, the pelvic brim is also called the pelvic inlet. Okay, and where the pelvis comes together, and we have these little spikes that come together from the lower portion from the ischium and so forth, basically that would be the pelvic outlet. And that has to be the size to allow a baby's head to come through in regards to that birth canal. Okay, we also find what's called the pelvic axis, and you can't see this. This is looking on a frontal plane. If we looked at it this way, front actually coming down a little bit. It's angled from forward and a little bit high to downwards. Okay, so it's almost like an axial plane with a little frontal plane twist to it. What happens is if I look from the side, coming from the uterus, it actually goes around this way. There's a little bit of a curve for that baby to be born. That's called the pelvic axis. It's a curved line that goes through the pelvis and joins the central points of the pelvic inlet and the pelvic outlet. That's the root of the baby's head through the birth canal. Okay. A couple last things about that, and I'll show you some x-rays of the pelvis, is male versus female pelvis. Okay, a couple things that are classic. The male pelvis is much larger and heavier with very large surface markings. Okay, the female pelvis is wider and shallower. Okay, and there's more space. Now, if I look over here, okay, if I look at the images on the right side, this is male, this is female. On this side, if you look, the pelvic inlet is much larger on the female, and also if we look at where the ischium, or where that inferior ramus of the pubis and the superior ramus of the ischium, so the inferior ramus of the pubis meets the superior ramus of the ischium coming up like that. If I look at the angle in female is much wider. The angle in males is much smaller, and that shows the difference. Again, the female pelvis has a tendency to be wider. Also, if you look at this looks shallower, this looks higher and deeper, where this is more shallow, that's basically looking at a female pelvis. So let me just give you a better idea. Let's look at this right here. Okay, it's the male on the left-hand side. We can see there's the female. Let me get rid of my picture there so you can see it's a female. You can see the difference here. If you look at that superior ischial ramus and inferior pubic ramus right in here. Okay, and you look at that angle here in females. Let me do that I should have done that in yellow, shouldn't I? Is much different. Okay, is much wider. I did it again. Jeez. Is wider as compared to narrow here. Also, if I look at the size of that pelvic brim in the females is much more open, much more wider. Again, it has to accommodate a head going down to the birth canal. Okay, and that's the big thing. That's one of the bigger difference between a male and a female pelvis. A couple other things we could actually see here. Let me get rid of some of the things that I've drawn in here. Okay, and just to sort of point a couple points out, this right here is that what I talked about with that sacral promontory. It's actually sort of curved, like a little hill in this area. So that's the sacral promontory. Okay, here again is the SI joint. This would be the iliac crest up in here, anterior superior iliac spine, anterior inferior iliac spine. Here's the acetabulum. Here's the superior ramus of the pubis, inferior ramus of the pubis. Here's the ischium, ischial tuberosity. You can't see behind. You can't see things such as the ischial spine, which is basically part of that pelvic outlet, which you can't see. Okay. Anyway, that's just looking at some of the pelvic things that I saw. Let's look at some radiographs to get some ideas as to what we see here. A couple things we can see here. Obviously, you can see the iliac crest up in here. Here's the iliac crest. Okay. We can see the ASIS right there. You can't see it. Someone put a line right there. AIIS would be sitting right here. Here's the acetabulum sitting right there. Here's the ischium. Here's the pubic symphysis right here. Here's the superior pubic ramus. Inferior pubic ramus, the superior ischial ramus. Here's the SI joint sitting right there. See that line, the SI joint? This is the area of the sacral promontory, which will be right here. Here's the sacrum actually coming here, and here's the coccyx sitting back in there. Okay, here's the acetabulum over here with the femoral head. Okay, so those are some of the things we see. Let me just get rid of those so you can actually look at those. We'll show you more of those. There's going to be more of those coming up here. Okay, that's just one x-ray. Got tons of them here. This one is a little bit better outlined so you can actually see things a little bit better. Okay, and if we look, here's the anterior superior iliac spine sitting right there. Here's the anterior inferior iliac spine. Okay, here's the acetabulum. You can see the acetabulum here, superior ramus of the pubis, Here's that obturator foramen. Here's the ischial tuberosity. Okay. Here's the SI joint right there. SI joint, iliac crest. Piece of cake, easy. You should know these things. These are pretty simple. Okay. Hard to see the greater sciatic notch. The greater sciatic, it's just really hard to see it there. Okay. This would be the pelvic brim right there. So that's what we see with that. So let me go back and get rid of those. So that way, if you go back and look, you could actually look at those, and I'll just stop for a couple of minutes so you could actually take another. You could stop the video here if you want to look at it and try to identify those. That's pretty good. Pubic symphysis. There we go. Okay, want to go? Same thing here. Pretty much the same image, just a little bit different view, and the same stuff we talked about on the last image. This is a little bit more. Okay, just another image. We could actually see, if we look here, here's the acetabulum. Okay, the acetabulum right here, superior ramus, the pubis, obturator foramen sitting right here, obturator foramen. Here's the inferior ramus, and here iliac crest. Here's the SI joint. You see it right there. See that little line, that little river that runs through? Here's the SI joint sitting right there. Here's the sacrum. The sacral promontory would be sitting right there. Anterior inferior iliac spine. Anterior superior iliac spine sitting right there. Anterior superior iliac spine was right there. Anterior inferior is going to be right there. Okay, so that's what we see in this. If you look at, you see how this, it says bowel gas? That's what it is. See all those little darker areas? That's just gas. It's in the intestines. That's all that is. You're going to see that all over in most abdominal x-rays. Okay, go back in here, same thing, just another view of the same thing. So all these things we've actually looked at before. Just, again, repetition is the more important thing than anything else. How many times you actually see something. What's this? That's bowel gas, like we talked about before. That's bowel gas, and stuff like that. Okay, these are called sacral struts. When we talk about the sacrum, we're going to see what happens to our foramina, and these foramina are basically holes. So they're in the sacrum to let these nerves come out, and therefore it creates a strut-like appearance across it. We'll talk about that later on. Okay, so let me get rid of those so you could actually, if you want to look at that again. Okay, you could stop. Okay, let me go on. Again, more the same that we talked about before. All these things we've seen before. Nothing much different. All those we've talked about, you should be able to identify all those. And another one. Okay, just a different view. Everything else is still diagrammed here as to what you see. So SI joint's probably a little bit easier to see on this one than it was on some of the other ones. The SI joint sits right there. It's the SI joint sitting right there. Okay, so these are things you should be able to identify on an X-ray. Another one, SI joint is actually pretty good right there as well. SI joint looks really good right there. Pubic symphysis, inferior pubic ramus, superior pubic ramus. I'm not sure if I agree with the arcuate line. On this one it says arcuate lines. Arcuate line is the sacral neural foramen. It's not, if you have to look at, yeah, I suppose that's true. And this is actually more reflective of what we call the sacral promontory. Okay, more than anything else, but that's fine. They put it on, that's fine. Nope, big deal. More right here. Now, one thing I want to show in here that's a little bit different. Okay, you can see bowel gas and stuff like that. You can see the sacrum and stuff. This is just showing a little bit more abdomen and relationship of abdomen. Again, this area in here would be that pelvic brim. okay, that pelvic brim, that opening here, the arcuate line, iliopectineal line. So my arcuate line would be here, and the iliopectineal line would be coming this way, and the arcuate line then comes across this way, and then the sacral promontory is here, okay? But if we look at here, there's something here I just want to show you, and probably it's probably too early to show you, but I'll show you anyway. It says psoas muscle, psoas muscle. This is if you look right here, there's like a little shadow. It looks like a little TP. Sits right there. Okay, and that's a muscle that's on the back side of the abdominal wall. And what happens is that inside the iliac crest, okay, that cup area inside the iliac crest and that iliac fossa is filled with a muscle called the iliacus. Iliacus. Okay, we'll talk about that later on when we talk about muscles. What happens at iliacus then meets with the psoas muscle, it becomes the iliosoas. Iliopsoas muscle. And what happens is you should be able to see this little tent-like structure back here on a normal x-ray. Sometimes if we have fluid or something like that, they take these x-rays lying down. If somebody of you have like fluid or something like that, you can't see that because the fluid sort of obliterates that little border. Let me just show you, just get rid of that so you can see that, you can see where the psoas muscle is. See the little line right there? And it comes down and you can see it right there. Okay, it's called the psoas shadow. Just another one, same thing, another AP pelvis. Okay, superior pubic ramus, sacroiliac joint, acetabulum. Not much more than we talked about before. The same thing before, just different. Okay, so what we've talked about in this video is we talked about a very complex but sort of a very beautiful structure called the pelvis, how it actually comes together. We showed you how it comes together in a neonate, newborn, versus a child versus an infant versus a child, and how it starts to come together actually with three bones coming to unite to one large solid bone at a certain age. Okay, we talked about the different parts. We talked about the ilium. We talked about the ischium. We talked about the pubis, the various parts about those. We talked about the differences between male and female pelvis in this video. Okay. I think you should be able to identify most of those major landmarks that we talked about in regards to the pelvis. And again, it's going to be important to understand a little bit also about the acetabulum, because the acetabulum is a place where that femoral head has to stick inside of. Sometimes with hip arthritis, the cartilage that's inside there gets worn away, and all of a sudden then the cartilage on the head of the femur gets worn away, and we have raw bone sitting against raw bone, which is a problem. So anyway, hopefully this all makes sense to you. You can go back and again the videos, and you can go back and watch it all you want. If you can't sleep, you could go back and look at it, and you'll fall asleep in the first 15 minutes or something like that. Again, be careful watching pregnant females. It'll end up in jail, okay? And I didn't suggest it, so don't do that. But anyway, hopefully it gives you a good basis in regards to what we see with the pelvis. As always, if you have any questions, make sure you let me know those questions you might have. And if not, stay safe and stay healthy, and we'll talk to you again with the next one. Next video will be involving the femur and the tibia and the fibula. Okay, we'll talk to you a little bit later. Okay, bye-bye.